Cataract surgery is one of the miracles of modern medicine. With a 10-minute procedure, we have the ability to take someone who was previously blind to seeing perfectly again the next day. But despite the incredible advancements we've made in surgical technique and technology, there are still patients who suffer from poor outcomes after surgery. You may have heard, maybe from a friend or family member who had the surgery, and unfortunately, maybe they've been dealing with problems of poor vision ever since their surgery. So in this video, I'm gonna go through the top 6 mistakes that patients and their surgeons want to avoid so that you can enjoy a successful outcome after cataract surgery with comfortable, clear vision. By the way, I'm Dr. Michael Chua. I'm a board-certified ophthalmologist, and I make videos to help you see better, look better, and feel better too. The first mistake you want to avoid when planning cataract surgery is not addressing uncontrolled diabetes. A recent research study from Italy, which looked at the medical history of patients receiving cataract surgery, found that 20.4% of patients had underlying diabetes. And if we look at the latest reports from the CDC, we see that the rate of diabetes in patients over 65, which is the most common age group for cataract surgery, is 29.2%. These studies tell us that a significant portion of our patients who are receiving cataract surgery also have diabetes. And this is very important because we know that patients with diabetes and uncontrolled blood sugars have a significantly higher risk of having complications with cataract surgery. My experience and countless research articles back this up. We see that patients with diabetes have delayed wound healing, increased risk of little scratches in the cornea or epithelial defects after surgery, higher risk of post-operative infection or endophthalmitis, higher risk of posterior capsular opacification, or basically clotting of the capsule or the bag that we implant the new lens into, and also a significantly higher risk of developing macular edema or swelling of the retina, which will affect your vision. So what can you and your ophthalmologist do to help mitigate these risks? Well, we already talked about controlling your blood sugars, but also your surgeon will want to consider using not only a steroid eye drop, but also a non-steroidal anti-inflammatory drug or NSAID eye drop, such as bromfenac or ketorolac after surgery. This is because using a combination of steroid and NSAID eye drops have been shown to significantly decrease the rate of post-operative macular edema in patients with diabetes. Your ophthalmologist will also want to consider injecting some antibiotics into the eye at the end of surgery, as this has been shown to significantly decrease the rate of post-operative infection or endophthalmitis. Okay. The next mistake we want to avoid when going into cataract surgery is not adequately managing dry eye syndrome. A meta-analysis published in 2022, which looked at all the previous studies investigating dry eye after cataract surgery, found that 37.4% of patients who did not have a previous history of dry eye, 37.4% of patients went on to develop dry eye disease after cataract surgery. Now, fortunately, for most patients, these dry eye symptoms are only temporary. But if we have patients who already have a history of dry eye syndrome before surgery, we know that they are very likely to suffer worsened symptoms during the post-operative healing period. So we'll want to make sure we tune up the dry corneal surface as much as possible prior to surgery to help decrease the severity of symptoms. I've gotten into several deep dives into different dry eye treatment options in previous videos, but treatment will likely include some combination of lubricating eye drops, perhaps prescription eye drops, warm compress, punctal plugs, or other procedures to help moisturize your cornea. The other important consideration of dry eye and cataract surgery is that if you have dry eyes during your preoperative planning, this can affect the measurements we take to decide which lens to put into your eye during surgery. As your ophthalmologist is planning your surgery, we take precise measurements of your eye, including the curvature or shape of your cornea and the length of your eye, so we can determine exactly what power lens we need to implant into your eye to help you see as clearly as possible after surgery. If your corneal surface is very dry during these measurements, then the measurements will be inaccurate, and this can cause your ophthalmologist to choose a lens that isn't quite right for you. So your ophthalmologist will need to diagnose your dry eye syndrome during preoperative planning and treat it aggressively. Then repeat your eye measurements perhaps several times to help ensure that they can choose the best lens for you. Okay, the next mistake you or your ophthalmologist will want to avoid before cataract surgery is missing other eye conditions such as glaucoma, macular degeneration, or amblyopia which will affect your vision even after cataract surgery. During your cataract evaluation, your ophthalmologist will perform a comprehensive review. They'll check on the health of your retina and your optic nerve, and the goal is to uncover any other eye diseases that can be affecting your vision. At our practice, for example, we perform OCT retinal scans as well as wide-field retina imaging on all of our cataract surgery patients to help us catch any underlying eye conditions. There are other conditions, such as keratoconus, which is basically steepening of the cornea or the front surface of the eye, so the shape is more like a cone rather than round like a ball. This will affect your intraocular lens calculations, so we'll want to look out for that condition. Another important condition we screen for during the preoperative evaluation is called Fuchs dystrophy, or basically a disease of the inner lining or the endothelium of the cornea. And if you have this condition, this increases the risk of corneal swelling or even needing a corneal transplant after cataract surgery. So that's a condition we don't want to miss. The other important reason to screen for all of these other eye conditions is because it will affect which types of lenses you'll be a candidate for during surgery. For example, patients with more advanced glaucoma, macular degeneration, or diabetic retinopathy usually aren't good candidates for premium lenses such as multifocal or extended depth of focus lenses because their visual outcomes may not be so good even after surgery. So all this to say that a comprehensive, thorough preoperative evaluation is super important for your cataract surgery. Okay, the next mistake I see with cataract surgery is incorrect expectations. Now, the lens and surgical technology we have for cataract surgery is incredible, and we can give patients wonderful vision with surgery. But sometimes patients may be expecting to have vision like when they were in their 20s, perfect vision for distance, intermediate, and near, without any drawbacks or side effects. Unfortunately, we don't have the technology to give patients absolutely perfect vision like when we were all younger. And so it's up to us ophthalmologists to let patients know what to expect in terms of vision after surgery. For example, if a patient is receiving a basic monofocal lens with cataract surgery, patients will usually still need to wear glasses even after surgery. And even if patients receive the latest and greatest lenses, maybe extended depth of focus lenses like the Symphony or Vivity, or trifocal lens like the PanOptix, there still may be some times where patients may need to use reading glasses. For example, in darker environments, trying to read small print up close. Another particular situation where patients may need to temper their expectations with cataract surgery is if they've had LASIK in the past. Now, after we take measurements of the eye to plan for cataract surgery, we usually use calculators which assume a normal corneal shape. But in patients with a history of LASIK, during LASIK, a laser was used to alter the shape of the cornea. And because the shape of the cornea has been altered with LASIK surgery, the typical formulas we use for lens calculations are no longer accurate. So we have specific formulas that help us to account for a patient's history of LASIK. But research shows us that even with the latest formulas, patients who have a history of LASIK have a slightly more unpredictable outcome in terms of residual glasses prescription after surgery. Okay, the next important mistake to avoid with cataract surgery is not following post-operative instructions. So, cataract surgery went smoothly, everything's looking good, but we're not out of the woods quite yet. Every doctor will vary in terms of what post-op medications they prescribe, but usually we will prescribe some combination of antibiotic eye drops, steroid eye drops, and non-steroidal anti-inflammatory eye drops after surgery. These drops are important for the healing process. For example, steroid and anti-inflammatory eye drops help treat and prevent inflammation in the eye after surgery, and they help to prevent swelling in the retina or macular edema after surgery. There have been several times after surgery where a patient comes back a week or two later with a painful red eye and sensitivity to light, and basically inflammation in their eye after surgery. I ask them if they've been using their post-op drops, and they'll say, "No, I didn't really feel like I needed them." But once I get them back on their eye drops, their inflammation and symptoms improve quickly. The other important set of instructions to follow after surgery is not to do any heavy lifting or anything too strenuous for the first couple of weeks after surgery. This is because the incision from surgery still needs time to heal, and we want your new implanted lens to stay exactly where we placed it during surgery. I've heard stories from several surgeons of patients maybe playing golf or tennis a day or two after their cataract surgery, and as the patients strain with a strong swing of a racket or golf club, they can inadvertently cause a buildup of pressure inside the eye and cause the iris to burp out of the cataract surgery incision. This is obviously a complication we want to avoid, as these patients have a significantly increased risk of infection and may need a trip back to the operating room to put everything back into place. So after cataract surgery, remember to follow your surgeon's instructions and take it easy for those first few weeks after surgery. Before we discuss the next mistake you want to avoid with cataract surgery, I wanted to quickly tell you about my optimized newsletter. If you want science-backed tips on how to protect your vision and health delivered straight to your inbox, you can sign up for my optimized newsletter at michaelchuamd.com. Okay, the last mistake I'll talk about when it comes to cataract surgery is waiting too long for surgery. Now, in most cases, cataract surgery is an elective surgery, meaning you and your doctor decide together when to proceed with surgery. Usually, we wait for cataracts to be visually significant, meaning that the cataracts are causing vision problems that are affecting the activities you do every day, like reading, driving, watching TV, or looking at your cell phone. And most of the time, there really is no rush, no pressure to get the surgery until the patient is ready. Having said that, there is an ideal window of time to get cataract surgery in terms of safety. We usually grade cataracts grade 1 through grade 4, with grade 1 being mild, grade 2 being mild to moderate, grade 3 being moderate to severe, and grade 4 being severe. Usually, the best time to get cataract surgery is when the cataract is grade 2 to 3. This is when the cataract is dense and cloudy enough to be affecting your vision, so you would notice a significant benefit to your vision after surgery. But when we venture into surgery on grade 4 cataracts, since the lens is denser, thicker, and cloudier, surgery on these dense cataracts usually requires a bit more manipulation in the eye and can increase the risk of complications, such as corneal or retinal edema or swelling, or maybe damage to the capsule, which is the membrane that holds the lens in place. And so when we start getting into that grade 2.5, grade 3.5 territory, we do want to consider cataract surgery before the cataract progresses to a severe grade 4 cataract. During your appointment with your ophthalmologist, go ahead and ask them, what's the grade of my cataract? If you're a little bit hesitant towards surgery, feel free to ask, how much longer can I safely wait for surgery? These are good questions to have prepared going into your cataract surgery consultation. Okay, so that was a whirlwind review of some of the most important mistakes to avoid when considering cataract surgery. In summary, some of the things we want to remember when considering cataract surgery are controlling blood sugars and diabetes preoperatively, as uncontrolled diabetes can increase the risk of complications after surgery. Manage dry eye disease before surgery, since we know that it's very common for patients to develop or to have worsened dry eye symptoms after surgery. Although in the majority of cases, this dryness improves with time. Receive a thorough evaluation to rule out any other ocular conditions, such as macular degeneration or glaucoma, as these will affect your vision even after surgery. And these conditions will influence which intraocular lens you may or may not be a candidate to receive during surgery. Have realistic expectations about what kind of vision can be achieved after surgery, particularly if you're thinking about premium multifocal or extended depth of focus lenses, or if you've had a history of LASIK. Our technology is incredible, but unfortunately, there's nothing that can bring back the vision from our 20s. Follow post-operative instructions, including using your post-operative eye drops and avoiding strenuous activities for the first couple of weeks after surgery. And lastly, to have a good, detailed conversation with your surgeon about when is the best time to safely proceed with surgery. Okay, I hope this review was useful to you. If you live in the Los Angeles, Orange County, or Inland Empire area and want to get checked for cataracts, feel free to visit our website or give our phone number a call to make an appointment today. And don't forget to subscribe to the channel to get all the latest updates. And if you made it this far into the video, that probably means you're really interested in learning more about cataract surgery. You can watch my video here to learn everything you need to know about cataract surgery and what to expect with the procedure. I'm Dr. Michael Chua with Point of Hills Eye Care. See you next time.